Orbis International is an international non-profit non-governmental organization, NGO, dedicated to saving sight worldwide. Its programs focus on the prevention of blindness and the treatment of blinding eye diseases in developing countries through hands-on training, public health education, advocacy and local partnerships. Since 1982, Orbis capacity building programs have enhanced the skills of 325,000 eye care personnel and provided medical and optical treatment to more than 23.3 million people in 92 countries. Orbis is a registered 501(c)(3) tax-deductible nonprofit charity in the United States. It was rated 4 stars on Charity Navigator in 2016 and was a GuideStar Gold participant. It is headquartered in New York, with offices in Toronto, London, Dublin, Hong Kong, Macau, Shanghai, Singapore, Cape Town, and Addis Ababa. Orbis programs emphasize skills, training, and self-sufficiency. The organization spends approximately a year planning and coordinating with partner hospitals and local organizations, making preliminary visits to observe the local medical teams. Its Flying Eye Hospital not only gives care to patients, but also provides training to local staff and delivers equipment and surgical supplies to ensure that local teams are able to continue to help people long after the plane has left the program site. CyberSight, Orbis telemedicine program, continues the training and mentoring relationships. Orbis intervention are tailored to local needs. Orbis trains local doctors in low-tech, low-cost yet effective methods to correct diseases of the eyes. In addition to the Flying Eye Hospital, Orbis operates hospital-based programs in several countries and works with local medical research and healthcare organizations on blindness prevention and eye disease treatment. Orbis is a founding partner, along with the World Health Organization, of Vision 2020, the Right to Sight, a worldwide concerted effort designed to eliminate avoidable blindness by the year 2020. Orbis was founded in 1982 with a grant from the U.S. Agency for International Development, USAID, and a number of private donors. The first Flying Eye Hospital was a Douglas DC-8-21, N220RB, donated by United Airlines. In its first 2 years of operation, the Orbis DC-8 visited countries and held programs emphasizing the hands-on transfer of surgical skills. By the late 1980s, as replacement parts for the aging DC-8 became more difficult and expensive to obtain, it became clear that a newer, larger aircraft was needed. Funded by private donations, Orbis purchased a DC-10 in 1992. The DC-10 contained twice the interior space of the original DC-8. After 2 years of conversion and renovation, it was placed in service in 1994, and the DC-8 was retired and donated to Chinese Aviation Museum near Beijing, China. That summer, the new Flying Eye Hospital took off on its inaugural mission to Beijing. In 1998, Orbis embarked on a new path based on the strategy to strengthen the capacity of local partners in the developing world to prevent and treat blindness through full-time, ongoing in-country programs. These programs were designed to respond to the needs of individual ophthalmic communities and local eye care providers. Orbis selected the first initial 5 countries to work in year-round based on need, magnitude of blindness, opportunity, local infrastructure and resources, and safety and stability to operate in-country. Orbis launched its first permanent country program in Ethiopia. Country programs in Bangladesh, China, India, Spain, and Vietnam soon followed. In 2010, Orbis established a country program office in South Africa. Permanent Orbis offices in these countries, run by local staff, develop and implement an array of multi-year projects to improve the quality and accessibility of eye care to residents, particularly in rural area and impoverished urban communities. In addition to permanent country offices, Orbis also engages in long-term program work in countries in Latin America and the Caribbean as well as in countries including Nepal, Zambia, and Burkina Faso. On April 7, 2008, Orbis announced it would replace the DC-10 Flying Eye Hospital with a DC-10 Series 30 freighter. United Airlines, with the support of FedEx, is donating the airplane to Orbis. On August 8, 2011, FedEx announced that it would donate one of its DC-1030s, retrofitted with the MD-1030F upgrade, to Orbis to replace its DC-1030F. The new MD-10 will feature a modular hospital suite, the first time these units will have been used on an aircraft. The Orbis Flying Eye Hospital. Orbis is well known for its Flying Eye Hospital, an ophthalmic hospital and teaching facility located on board a McDonnell Douglas DC-10 aircraft. The Flying Eye Hospital brings training to doctors and nurses in developing countries with little access to professional development and training. Classrooms, operating theaters, and laser rooms are aboard the aircraft, and the local medical personnel are able to watch live surgeries as well as simulations. 3D filming and broadcast facilities allow the local ophthalmic professionals to observe the live surgeries through the eyes of the surgeon. Surgeries can also be broadcast to additional classes outside of the aircraft, be it a local hospital or halfway across the world. Participants can ask questions via a two-way audio-visual system. Volunteer pilots donate their time and skills to fly the hospital to the various program sites. In June 2016, Orbis revealed its third-generation Flying Eye Hospital. The hospital is a converted McDonnell Douglas MD-10 donated by FedEx and can fly twice as long as its predecessor. It is similar to a land-based hospital and is outfitted with safety features such as a backup generator and early alert monitoring systems. The hospital also has its own water treatment plant and air conditioning systems. It also houses a 46-seat classroom, sterilization room, and operating room, and uses 3D technology and live broadcast systems which allow local participants to observe surgeries while they are taking place. A virtual tour of the plane was created as part of the launch, which enables users to virtually explore all areas of the plane including the operating room and cargo hold. Orbis's previous DC-10-10, which was the oldest flying example of its type by then, has since been donated to the Pima Air and Space Museum. It arrived at Davis, Monthan Air Force Base in November 2016 and is currently on display in the museum. Country programs. In addition to the Flying Eye Hospital, Orbis operates long-term country programs and collaborates with local governments and organizations and push for eye care to be integrated into national health programs. It has also worked with local universities and healthcare institutions and manage a team of more than 400 medical volunteers from 29 countries to provide expert training to their local partners. In each country, Orbis works with its local partner institutions to increase their capacity to provide comprehensive, affordable and sustainable eye care services over the long term. The programs include developing specialized hospital facilities, eye banks, patient and healthcare worker training, and prevention and treatment programs. In 2015, more than 30,000 medical professionals were trained and more than 2 million patients were examined either on board Flying Eye Hospital or at its partner institutions. CyberSight. CyberSight is a telemedicine portal founded by Orbis that allows eye health workers in low and middle-income countries to consult with expert mentors in their field, free of charge. Mentors give their opinion on patient cases, share learning materials, and help local eye health workers develop their skills in blindness treatment and prevention. Since its launch, more than 10,000 electronic cases have taken place. This allows for distance learning and discussion. CyberSight also offers regular live lectures, a library of educational material, and allows users to take tests and receive certificates of achievement. On September 10, 2018, Orbis announced a new collaboration with AI company Visulytics to apply their automated imaging technology to CyberSight. Visulytics' Pegasus AI system will be used to analyze images of the back of the eye taken with any standard retina camera or smartphone. Eye doctors in low-resource countries will be amongst the first in the world to have free access to this service on the CyberSight platform, helping them detect and diagnose sight-threatening eye diseases such as diabetic retinopathy, age-related macular degeneration and glaucoma, as well as quickly request a second opinion from Orbis's network of medical experts. Orbis is an international nonprofit best known for our Flying Eye Hospital, a plane unlike any you've seen before. It's a state-of-the-art teaching facility complete with operating room, classroom, and recovery room. This amazing aircraft has been an example of the marriage between medicine and aviation since 1982. The Flying Eye Hospital is the world's only fully accredited ophthalmic teaching hospital on board an MD-10 aircraft. Equal parts teacher, advocate, and envoy in the global effort to end avoidable blindness, our state-of-the-art flying plane allows our clinical team and world-leading volunteer faculty, medical experts, to travel the world sharing knowledge and developing the skills of eye care professionals in the communities that need it most. Once a cargo plane, the interior of our third-generation Flying Eye Hospital, an MD-10 donated by FedEx, was completely transformed with the support of our many generous partners. Over the past 4 decades, thanks to our compassionate supporters, 3 generations of the Flying Eye Hospital have taken world-class training to eye care teams in 80+ countries and been a call to action for better eye care around the world. Wherever it lands, it raises awareness, creates change, and rallies supporters from local governments, global organizations, and philanthropists to the general public to join the global effort to end avoidable blindness. The Flying Eye Hospital is invited to help train local eye care teams by officials in every country where it lands. Not only does it provide a space to train doctors, nurses, biomedical technicians, and other eye care professionals, but it also opens the doors to prime ministers, presidents, and ministries of health so that we can make the case for investing in eye health for all. Our amazing staff and volunteers can then work in partnership with local hospitals to understand skills shortages and work where the need is greatest. This level of access has allowed Orbis to help change health policies for the better, reach eye care teams in need of training, improve the lives of those lacking access to care, and develop lasting bonds with people around the globe to ensure long-term impact. The Flying Eye Hospital is not only packed with the latest medical equipment, it has some of the very latest training facilities, too. The entire plane is outfitted with an advanced audio-visual system that allows training participants in the classroom to watch surgeries happening in the operating room live in 3D, making it as close to the real thing as looking down the microscope yourself. A two-way microphone also allows training participants to ask questions about the operation and for the surgeon to share details about the procedure, enhancing the learning opportunity. The aircraft also features a state-of-the-art mobile simulation center. Just as pilots learn to fly planes through simulation training before taking off from the runway, simulation training in ophthalmology allows eye care teams to build their skills and confidence safely before progressing to real-life surgeries. Inside the Flying Eye Hospital, Orbis offers simulation training using technology like virtual reality, artificial eyes, and lifelike mannequins, allowing for complex surgical procedures to be broken down into smaller parts. This gives eye care professionals the opportunity to practice each step as many times as they need to get it right, something that's not possible with an actual patient. As a result, simulation training has been shown to improve surgical outcomes for patients. Whether a program offers simulation training or live surgical training, Orbis always creates tailored and customized curricula for our partner hospitals' needs, based on what skills are most needed locally and their equipment's capabilities. Volunteer faculty train local eye care teams both on board the aircraft and at their local hospital, providing education that is both high quality and practical for when the Flying Eye Hospital departs. And thanks to our telemedicine platform, CyberSight, eye care professionals from all over the world can join our training programs with the click of a button. Training activities, including live lectures and surgeries, on board the Flying Eye Hospital are broadcast via the platform to partner hospitals and classrooms around the globe. The pandemic taught us many valuable lessons about virtual learning. In 2020, Orbis reimagined in-person Flying Eye Hospital trainings as virtual ones to ensure that eye care teams could still access critical training safely during the pandemic. Orbis reached 9 countries in 2020 and 34 countries in 2021 through virtual Flying Eye Hospital projects. Now that in-person programming is back in action, we plan to continue with a method of blended learning to give eye care professionals a more well-rounded education. Blended learning is the combination of in-person simulation and surgical training on board the Flying Eye Hospital with tailored virtual training offered at home via Cybersight, Orbis's telemedicine and e-learning platform. This model adopts the best of both training methods into one, ensuring that participants can begin their education before the plane arrives and continue their education after the plane leaves. Thank you for watching this video.